Okay. So you will find the sin down, and by the side you will find the ears, the auricle. Okay, that is what is the boundary of the face. So in the face, you find certain orifice like the nasal orifice, oral orifice, orbital orifice. Not the orbital orifice, you get the orbit. In the orbit, you get the eyes. Nasal orifice, you get the nasal cavity. Inside, you are getting the nasal cavity. Okay. Then you find the oral cavity. Okay, the oral orifice leads into the oral cavity. Okay. Can you see the screen I am sharing? All of you? Hello? Yes,
Yes, sir.
Yes, sir.
Yes, sir.
Screen, all of you? Right. So this is
Yes, sir.
a beautiful face, isn't it? A girl with beautiful face. With old age, you see they'll be wrinkling in the face. And to finish those wrinkles, people go for Botox therapy. And with that, you'll find those wrinkles will be vanished. Okay, I'm letting people to come inside, still many people are coming. So anyways, such a beautiful face you see in this picture. Okay. And in the face you see particularly upper this eyelids, just beneath the skin you don't have the subcutaneous fat. Immediately down to the skin you get the subcutaneous tissue. In other parts of the face, in other part of the face you have subcutaneous fat and all. So you don't get in the eyelids, and also you don't get in the nose also. And in this places you see this particularly the nose and all, the skin is tightly adherent to the subcutaneous tissue. And if there is some sort of pimples, you find it very painful. And you find this face, it has got muscles of facial expressions. And this, in the subcutaneous tissue of the face, you will find lot of anastomosis between the blood vessels. So if there is a cut in the face, somewhat like near to the lips, you find there will be profuse bleeding, because you see there will be anastomosis between the blood vessels, profuse anastomosis between the blood vessels, and you see the blood is part from both ends. So today we'll learn about the muscles of the face. Okay, and we'll discuss about the facial artery, the venous changes, and also the nerve supply, plus the applied anatomy. Okay, so it is a very interesting topic, simple of course, and it comes to the examination of all the things. I'll tell what are the important things you should know from the facial region. Again, you can see the expressions of the people here. So this person you can see what is his expression like. Surprise. Okay, so this is a beautiful lady showing her beautiful face. This guy is showing her his anger. This guy is laughing. This kid is laughing. This baby is also showing some surprise. Okay, and this lady is going into depression. And this is the face you can see in old age. So many wrinkles in the face. Okay, so many wrinkles. All of you can see this slide. All of you, can you?
Yes, sir.
Okay. So nice faces are there. Sadness, anger, happiness, joy. Okay, all these are can be shown in the face. Actually, the things are happening inside the brain, and from the brain, it comes to the facial muscles, the muscles of facial expressions. So these muscles are some sort of some motor units. Okay, everything is happening inside the cerebral cortex. Okay, and from there the impulses comes and it is supplying to the muscles, and thereby you show the expressions. So without speaking also you can give some messages. Okay, you can you can give certain messages. You can show anger, you can show happiness, all these things you can show by your muscles of the face. Okay, so you can see so many different types of expression out here. Now let us see. So expressions like happiness, surprise, disgust, sadness, fear, anger. Okay, so you find that the facial muscles. So apart from human beings, see, there are no animals that have this sort of complex set of facial muscles. Okay, no other animals have evolved as complex a set of facial muscles as in humans. Still, people are coming. Okay, so morphologically, what happens? They represent remnants of caniculus carnosus, a coordinate subcutaneous muscle strip present in some animals. In lower animals, you have this caniculus carnosus. Lower animals, like you see the cows, okay, the horses and all, they have a sleeve round the neck. You have seen the cows, the ox, bulls, okay, horses, they have a sleeve down the neck. Have you noticed that? So thereby what they do in this area, they can drive off the flies that falls, the insect that falls, they can shake it and they can drive all those insects and all. So those muscles are what called the caniculus carnosus. Even in humans also we have this caniculus carnosus. Okay, it's a very subcutaneous muscle just beneath the neck, skin of the neck only. Okay, so it is called the platysma. In human, it is called the platysma. But in lower animals, the four-footed animals, it is known as the caniculus carnosus. Okay. Can you follow what I told you? The caniculus carnosus you find in cows, in horses, and all. The neck region, you can see they have a sleeve of skin. Okay, they can move that part of the skin and they can drive off all the flies and whatever comes, they can drive it off. Okay. Now you can see here the primary function is expression of emotions. The muscles of facial expression you see is the expression of emotion. The facial muscles are capable of performing 7,000 expressions according to Coleman. So you can show somewhat like 7,000 expressions. Okay, they are responsible for maintenance of posture of facial structure. Okay, again you will see they have this thing also. The facial muscles also contributes to stabilization of the mandible during infantile swallowing and swing and swallowing in occlusally compromised others. So these facial muscles you see, they stabilize the mandible. They stabilize the mandible in case of babies or infants, so that they can do the swallowing or swing. And also in people who have problem with the mandible, the occlusion, they have difficulty in swallowing. Okay, so in people who have this, these facial muscles can stabilize the mandible for swallowing or eating food. Now, so it is also important for visual and spoken communication. Okay, it is also important for visual and spoken communication. So without speaking also, if you see somebody, you can show some reaction in your face. And also, even if you don't speak out, you can show your facial expression with these facial muscles. All of you can follow me what I'm telling you? Yes or no? Hello, students?
Yes.
Okay.
Yes.
Very interesting.
Yes, sir.
Very interesting chapter. Okay. Lakshmi Prasanna has entered now. Please click. So these are what you see. The muscles of the face, the frontalis. Okay. See, when you contract the frontalis, you will see there will be creases in the forehead. will be tenderest creature, isn't it? Suppose you want to show some surprise, you lift your, contract your frontalis. That is what you see is a muscle from the scalp, actually, occipital frontalis. Posteriorly, you are getting the occipital, anteriorly, you are getting the frontalis. These are two bellies of frontalis you can see here. And by the side of the head, you see these are what called the temporalis. Okay. Then you see these muscles, they go round the eyeball. Okay. These are known as the orbitalis oculi. Okay. You see the procerus, corrugator superciliary. Then you see the nasalis by the side of the nose, zygomicus major, zygomicus minor. You get the masseter. This masseter muscle is a muscle of mastication actually. We used to do mastication, grinding of food. So this is a muscle of mastication. Even temporalis by the side of the head also, you get the temporalis. This is also a muscle of mastication. The zygomicus major, minor. Okay. Then you see there is a muscle, small muscle of course, but it has got the longest name and longest name. That is what's called the levator levi superioris electing nasi. A muscle, small muscle having the longest name in the body. This is the name of the muscle which has got the longest name. The name is levator levi superioris electing nasi. Okay, so you'll find it by the side of the neck. But the smallest muscle in the human body is what is the stapedius that you find inside the middle ear. But these muscles, although it is small, not the smallest, it has got the longest name levator levi superioris electing nasi. Can you follow me, students? Hello? Yes or no?
Yes, sir.
Then you see the muscles like I told you, the paniculus carnosus that you find in the lower four-footed animals. Even in humans also we have this paniculus carnosus, but it is called the platis spine. You will find it over here in the neck region, platis spine. The importance of platis spine is that in humans, it is arising from the subcutaneous tissue and it inserts in the subcutaneous tissue. I mean, there is no bony origin or bony insertion. Okay, that we find in the neck region. Then you find just below the lips, you find this muscle, the two muscles, of course, called the mantalis. You find the mantalis over here. This is the upper lip, and this is the lower lip. Round the lips, you find the orbitalis oculi. It's the orbitalis oculi, not the orbitalis oculi, the orbitalis oris. Oculi you find on the eyeball, okay? But here you find the orbitalis oris, right? Remember orbitalis oris. This muscle comes the soft of the. And this is the orbitalis oculi, it also comes the soft of, okay? Then you see there is another muscle called the buccinator. This is what is called the buccinator. It is the muscle that you find below the other superficial muscle, buccinator. So this muscle, buccinator, is also called the trumpet muscle. Trumpet muscle is what we blow trumpet, isn't it? We play some air instruments like the flute or trumpet. We use this muscle for blowing air from the oral cavity. That is called the buccinator. And even this buccinator is very much helpful in case of infants to suck milk from mother breast. So what happens? It creates some negative pressure in the oral cavity, and thereby it can suck milk from the mother's breast. This muscle called buccinator. Remember, buccinator comes as short. Remember this buccinator, orbitalis oris, orbitalis oculi. These are important for examination. Remember, as well as the muscles. I told you the masseter is a muscle of mastication that helps in grinding process. The temporalis helps in grinding process. Then you find the medial pterygoid, lateral pterygoid. Of course, those are deep muscles, but it falls under the muscles of mastication. And there are some accessory muscles of mastication as well. The digastric muscle, the suprahyoid muscles. Okay, those are some accessories muscles of mastication. We are not concerned with that. So we are concerned with the muscles of the face only that shows the facial expressions. So these orifices, like the nasal orifice, okay, the oral orifice, and this orifice you see having the eyeball. Down this eyeball you find this muscle orbitalis oris. So it acts like some sort of sphincter. So contraction of these muscles can lead to closure of the eyelids, the upper and the lower eyelids. We do blinking of the eyelids. We do blinking of the eyes with the help of this orbitalis oris. Even we use this oblique the oris. Okay, oblique oris. What we do, we can close the mouth, we can pop up the lips, all different sort of movement we can do with the help of the oblique oris that goes down the oral cavity. Will go it down the oral cavity. And even this muscles, you see that around the nose, what are called the nasalis. Okay, this is a muscle called nasalis. So it can flare up your this nails. These are called the nails, and you can depress the nasal septum as well. So when you are angry, you find that you blow your nails, the nasal nails. When you are angry, they are the swelling of this nails. Okay, you must have experienced yourself. Do you experience when you're angry, your nasal nails flare up? Do you? Yes or no? Students, tell me. Yes or no?
Yes, sir.
Okay,
Yes.
very interesting. Just keep listening. Okay. I'll take the important points, what you should remember, and the important muscles that comes in the examination. Not all these muscles are important for examination point of view, but you should know the names of the muscles. Okay. So these are the muscles that you find in the face. Okay. Now, the classification of the orofacial muscles. So oro means what? Round the mouth. Facial means the muscles in the face. So muscles of head, as you find this temporalis, right? Then you find the frontalis, craniofacial muscles, okay? Masticatory muscles, I told you already, the masseter, okay, the temporalis, zygomaticus major, zygomaticus minor, the lateral pterygoid, medial, all these things. And the craniofacial muscles you see from the cranial region, it comes to the face region, okay? So there are some these accessory muscles in lower animals, not humans, particularly in front of the ear, like the uh, anterior.
హలో సార్ వినిపించడం లేదు సార్
Pardon?
వినిపించడం లేదు సార్
You can't hear me?
వినిపిస్తలేదు సార్
I can't make out what you're telling. I'm not audible to you.
సార్
Am I audible to you or not?
వాయిస్ స్లో సార్
Internet is slow. Okay, just wait. I will go to a good place where I get the good connectivity. Just hold on. Just hold on. Signals are less only. Just wait. I'll go to a good place. Am I audible to all of you now? Hello? Yes or no?
Yes, sir.
Okay.
ఎస్ సార్
Yes. So these are the different muscles you find in the face. Some are coming from the head, some are from the side of the head, and you see some are in the face region only, and some are what helping the mastication, called the masticatory muscles. So the craniofacial muscles and the epicranial muscles, circumorbital or palpebral. Circumorbital means what? I told you, the eyelids. Okay, you have the orbicularis oculi that closes the eyelids. Nasal, you see, by the side of the nose. Okay, you have this nasalis, levator superior selective nasal. It will lift your nasal nails, and you see the bacolabial. So from the stick to the lips. Okay, so occipital frontalis, temporoparacalis, epicranial muscles. So these are different groups of muscles. Just you should know the names, the different groups. Okay, try to remember the names of the muscles. Okay, all these muscles you cannot remember, but you should know few of the muscles well. You see here the frontalis muscle you find in the forehead. You can see this is what is the frontalis muscle, two bellies of the frontalis. So when you contract this frontalis muscle, as you contract your forehead, While contracting the forehead, what happens is frontalis muscle contract, and you find there will be some transverse creases in the forehead. Can you see there are some transverse creases because of the contraction of the frontalis muscle? Okay, and so if the medial fibers of frontalis are contracted, you find there will be creases on the medial aspect. If the lateral fibers are contracted, you will find there will be creases on the lateral aspect of the forehead. If all these medial and the lateral fibers are contracted, you see there will be transverse creases all along the frontalis muscle. Is this picture clear to you? Yes? All of you tell me. Hello, students.
Yes, sir.
Sir.
Okay, good. Quite interesting. Okay. Have pleasure in learning only. Don't have the fear that I must remember and all things. Try to understand what we discussed. Try to understand. Who is this personality? You know the name? Who is this person? A great person, of course. Can you name this person? Anybody? Come on.
Michelle Obama.
Yes,
Um,
President of America. A very good person. You can see his face.
Barack
Yes.
Obama.
Barack Obama. Yes. Frowning face is showing. Okay. So he's showing some reaction to somebody, showing some frowning action. So, circumorbital or palpebral, I told you, around the eyes you get the orbiculis oculi. The orbiculis oculi muscles there go around the orbit. Then you find near to the eyeball, you get the corrugator supercilii by the side of the eyebrows on the medial aspect with the corrugator supercilii. And you get the levator palpebris superioris muscle. The levator palpebris superioris muscle, what does it do? You know, it lifts the upper eyelid. So you open your eyes. Which muscle contracts? You find that is what the levator palpebris superioris, a muscle you see that lifts your upper eyelid. Is it clear? So this muscle you find around the orbit. Okay. Now, in the nose region, you see, in the nose region, what you find the procerus. There's a muscle called procerus. There's another muscle called the nasalis. There's another muscle called depressor septi. So you can contract your nasal nails. When you are angry, you can flare up your nasal nails. So these are the muscles that come into play: procerus, nasalis, depressor septi. Okay. So this girl, you can see what she's doing. Anybody can tell me? Closing the eyes tightly, isn't it? Means
Yes,
the
sir.
yes, closing the eyelids very tightly. Which muscle comes into action? That is what the orbiculis oculi. This orbiculis oculi, you can see. So it is contracting, as well as these lids are also closing. This is the upper eyelid, this is the lower eyelid. Isn't it? These are the eyebrow. So here in this region, you get the muscle called the corrugator supercilii. Corrugator supercilii. So this is what you find. This is a fold you find between the nose and the tip called the nasolabial fold. All people have this nasolabial fold. You can see a groove. You can see it's a groove here called the nasolabial fold. There is a condition like if there is some paralysis of the muscle on one side, this nasolabial fold will be absent. You can make out in paralysis patient or in stroke patient, you find there will be loss of nasolabial fold on the side of paralysis. Okay. There is a nerve called facial nerve that supplies this muscle stone. So when there is stroke here inside the brain, so there will be paralysis of this muscle. So when there is paralysis of this muscle, you find there will be loss of nasolabial fold, and these muscles on the other side are very strong. They will contract. So there will be deviation of the angle of the mouth to one side. Deviation of the angle of the mouth to one side means what? This side muscle are very strong. Okay, they will contract and there will be deviation of the muscles of the mouth. On the other side, what happens? There will be no movement. These nasolabial fold will be absent. Right, your other effects also come. I'll let you know. I'll let you know. Okay, please don't make any noise. Please mute yourself from coming from some microphone. Okay. Now here in the in the in the buccal region, in the buccal region, what happened? There, buccal means what? The buccal cavity, that is called the oral cavity. You find the muscles what are called the elevators. The elevators will lift the lips, retractors, elevators of the upper lip, everters of the upper lip. You can evert the upper lip muscles. You can depress the lower lip downward. They are called the depressors, retractors, everters of the lip. So what happened, like if you do the eversion of the lower lip like this, then you heard the raise your upwards, those will be what there is the 155 global peak. Please don't make any noise. Which is this guy? Huh? Don't make any noise. Please mute yourself. So this buccolabial, I told you the lifts the upper lip, the lift the lower lip, okay? And you see the muscles that go around the oral cavity, means the orifice, what is on the orbicularis oris. Round the eye is known as the orbicularis oculi. Round the mouth will be known as the orbicularis oris. With a compound sphincter-like action. Again, I told you the buccinator. Okay, it's a blower's muscle. The muscle where by which you can blow air, just like we blow the trumpet or some air musical instruments like the flute, or you can inflate the balloon with the help of this buccinator. Okay, we'll come to this muscle. Very important, of course. Okay, now you can see how the baby is laughing. Okay, how the baby is laughing with a nice smile is putting, and you can see these girls. See how they are making their lips just like kissing somebody in the air, and this girl, the same girl, of course, putting both the lips inside the mouth, and this is what was kissing in the air. So these are all the muscles coming into play around the oral cavity. Okay, can you follow me, students? Hello, hello, students. Tell me. Yes,
Yes,
yes.
sir.
Okay, okay. Rule number 104. She has got she has got up now. Pujita Reddy. She has entered now. Very late. Okay. So sadness is how the baby is showing his sadness. Okay. And this person showing his irony. This elevation of the angle of the mouth. So his superiority, showing his superiority, like irony. Okay. Irony means what? It is there, it must be there. He is showing his expression in that manner. So this is the function of the elevator's muscle. Okay, levator levi superior is a muscle called levator levi superior. There's a muscle called the depressor levi inferior. There's a muscle called the levator levi angularis. They come to the angle of the mouth. They can contract the angle of the mouth. So this side the muscles are being contracted and so and showing an expression. Okay, so these are the action of the elevators. And this depression muscle you see, they will find that you find below the mouth. Okay, you find the levator levi inferioris. Okay, so this levator levi inferioris will depress the lips down. Depression. Okay, levi means what? This lips. Okay, the lips are called the levi. Buccal means what? Inside the oral cavity called the buccal. So the baby is showing sadness by contracting his depressor levi inferioris, and this person is showing his superiority, just like contracting the angularis muscle, levator levi angularis, levator levi superiorus. Okay, so he's showing his superiority like that. Okay, now you can see, and this is a great personality. I forgot his name, of course. He's showing his breathing action. Breathing action means like broad smile. He's showing his broad smile in his face. Okay, there is contraction of this angularis oris muscle, and he's showing his broad smile in his face. Okay, it's a sign of happiness only. So anyway, can you make out the name of this person? I don't know. Yeah, he's some prime minister of previous prime minister of UK probably. You know him? Do you? Anybody? Yeah. Can you hear me?
No, sir.
Oh, okay, fine. We'll leave it. Then I told you the muscles that helps in mastication. It's like mastication means what? Grinding your food, like the masseter. Okay, by the side of the face you'll find the masseter. You get a temporalis by the side of the head. You find the temporalis on either side. So when you clench your teeth like this, if you clench your teeth very tight, clench means what? You occlude your teeth. You can make out the masseter. You can feel the side of the stick. You can feel the masseter, as well as you can make out the temporalis. It will bulge out. Okay, and there are muscles like the medial pterygoid, lateral pterygoid. These are all the muscles of the mastication. And there are other muscles as well called the accessory muscles that helps do these main muscles like the suprahyoid muscles, the digestive muscles. Of course, these are not required for you right now. We'll come to these muscles of mastication later on. We are just into the muscles of facial expressions. So you see here, we use 24 muscles to smile, but we use 54 muscles to cry, or we use 54 muscles to show our anger. Okay. So if you want to do the exercise of the muscles, you can show your anger to everyone. Okay. You show your anger, and the other person will get angry, and he will spread the anger to everybody. Okay. If you smile, he will smile, and you will have good conversation. Okay. So you use only 24 muscles for your happiness or showing your smiling face, but use 54 muscles to cry. So the actions of muscles of facial expression include occipitofrontalis muscle. I told you occipitofrontalis. You can see here the contraction of this frontalis muscle. You can see there is some previous in the forehead. Corrugator supercilium, you can see like this. There is some sort of vertical wrinkles. Okay, corrugator supercilium. So this corrugator supercilium you find by the side of the root of the neck, the nose. Procerus and transverse part of the nasal is procerus and transverse part of the nasal. When they come in action, you can show your face like this. Orbital is oculi. So you can blink your eyes. You can blink both the eyes together, or you can blink one time. Okay. And levator levi superis elected nasi. So this contraction of this muscle will clear up your nasalis. Buccinator, I told you, the trumpet muscle, you can blow air. Okay. Zygomaticus major, zygomaticus minor. Okay, all this will be there. Then you find the rhizorius by the side of the nose. You find rhizorius by the side of not the nose, the mouth. You find rhizorius. The rhizorius, the pressure levi inferioris. So the rhizorius will be there by the side of the angle of the mouth, and you see the depressor levi inferioris will be down the angle of the mouth. And when it contracts, you see you can show a smiling face. Levator levi superis, as you show your teeth, you see the levator levi superis and the levator levi, the levator levi inferioris, okay, or the depressor levi, as you show your teeth. Okay, this muscle will contract, you can show your teeth. Then you find the other action as well. Just wait. Okay, the rhizorius, levator levi superis, depressor levi inferioris. So all this contraction you can show your teeth widely. Orbicularis oris. So you can make your pop up your lips like this. Orbicularis oris. Depressor anguli oris. So like this you can contract this muscle. You can show the depression of this angulus oris. The mentalis. So contraction of the mentalis, you see the mentalis muscle. Some you will find down the lip. Contraction of that you can show your lips like this. Okay. Then you see the platysma. I told you the subcutaneous muscle in case of lower animals like the called the paniculus carnosus you find in the neck region. So contraction of that you can show you this platysma action on the platysma as well. Okay, so these are the muscles that shows different facial expressions. Okay, so I hope that is clear to all of you. Yes or no?
Yes, sir.
Okay. Now you see here, these muscles of facial expression, they are supplied by the motor nerves as well as the sensory nerves as well. The motor nerve they comes from the facial nerve. So this is the facial nerve you can see. The facial nerve is the seventh cranial nerve. It comes from the cranial cavity, okay, from the brain of course. Then it comes out of the stylomastoid foramen. So there is a foramen called the styloid process. Between the styloid process of temporal bone and the mastoid process, okay, this facial nerve comes out, and this is the facial nerve. You can see this the green color. You can see them. So it enters the parotid gland. So this is the parotid gland. Okay. Then on the anterior border of the parotid gland, it will give branches. It will give branches. It will give five branches. Try to remember like this. This five fingers, this five branches. One is going to the temporal region. Temporal means what? This side is the temporal region. That's called the temporal branch. Then other will give to this region. The zygomatic bone is here. So that is called the zygomatic branch. Then it will give to the oral cavity. Okay, by the side of the oral cavity, that is on the buccal branch. So this is the buccal branch. So buccal branch again, it will divide the upper buccal and lower buccal. Then it will give one more branch at the level of the mandible. Okay, that is called the marginal mandibular branch. And there will be one more branch, what will be called the cervical branch. So this is the cervical branch, remember. So you find the temporal. So I try to remember, very important, we ask in the examination, what are the branches of the facial nerve in the face. So you have to tell the temporal, this is what is the zygomatic, this is the buccal, this is the marginal mandibular, then you find below what will be known as the cervical. So five branches, and these are all the motor nerves. So this nerves, it will supply the muscles of facial expression that shows different emotions in your face. Can you follow me or not? Tell me. Hello.
Yes, sir.
Okay. Try to remember, it's very important branch, the facial nerve that supplies the muscles of facial expression, is a motor nerve. So you are having these branches called the. Try to remember, going towards the temporal region. So this side is what is in temporal region. So this is what you see, the temporalis muscle. I told you the temporalis muscle. No, this is the temporalis muscle. You can see the temporal. You can feel the temporalis muscle. When a cancer fits very tightly, you can feel the temporalis muscle by the side of the head, temporalis muscle. Then you find this is the frontalis muscle. Can you see the belly of the frontalis? This is the orbicularis oculi going round and round the eyeball. Okay, the zygomaticus major, zygomaticus minor. This is what is known as the masseter. I told you masseter, muscle of mastication. This is the platysma. Okay, this is what you see round the world cavity is known as the orbicularis oris, and these are what the muscles round the nose, nasalis, right? Okay, so this is the seventh cranial nerve coming from the brain, coming out of the brain through a foramen called the stylomastoid foramen. Then it enters the parotid gland and it supplies the muscles of the facial expression. And these are all the motor nerves, and it has the five branches. Now coming to the sensory nerve supply. Okay, this sensory nerve supply, it will have different branches. The sensory nerve, it comes from the trigeminal nerve. So this trigeminal nerve is what cranial nerve? Any idea you know? So as I told you, the facial nerve is 7. What is the number of the trigeminal nerve? Is it first?
Fifth,
Yes, very
fifth
good.
cranial.
Very good. So trigeminal nerve is the fifth cranial nerve. So this trigeminal nerve, it will divide. Okay, it will give branches like the zygomatic branch, the maxillary branch, and the mandibular branch. Okay, not the zygomatic, you get the ophthalmic branch actually. So you find it will give many such branches from these main divisions. So these are all the sensory divisions in the face that comes from the trigeminal. So sensory nerves of the face, you see the supracochlear. You see, you just by the angle of the eyeball, you see there's a supracochlear. Then you find the supraorbital. Okay, a popular branch of the lacrimal. You find the infra trochlear, external nasal, infraorbital. Okay, zygomatic or facial, zygomatic or temporal. auriculotemporal, buccal, mental, auricular, chamber, squamous, arcs of length, lesser occipital, supraclavicular. But try to remember these sensory nerves, all they come from the trigeminal. They come from the trigeminal, and there's the beginning of the trigeminal comes. Okay, you're getting the ophthalmic division, you find the maxillary division and the mandibular division. So try to remember the sensory nerve that comes from the fifth cranial nerve, which is known as the trigeminal nerve. Okay. Now coming to these muscles, in case of lower animals, I told you it is called the carniculus carnosus. In case of humans, we have this called the platysma. That's the muscle you see in the neck region, a very much subcutaneous muscle. So it is also known as the polar muscle, and it is subcutaneous. Originates, you see, upper part of the pectoral region and the deltoid fascia. Upper part of the pectoral fascia. You know the pectoral muscles, no? Above the pectoral muscles to get the pectoral fascia. We have discussed long time back when we did the dissection of the upper limb, and also from the deltoid fascia. They run upward and medially. Okay, they run upward and medially, and inserts. Where does it insert? Anterior fiber to the base of the muscle. The base of the mandible is here. It will be inserted to the base of the mandible. Posterior fibers to the lower face and lip. So that is what the insertion of the platysma. So when you come back to the college, when you do the dissection of the head and neck, you will be able to see the platysma nicely. Just giving the skin incision, reflecting the skin, you can see the platysma. What does it do? You see here, releases pressure on skin onto the subjacent veins, depresses mandible, pushes the angle of the mouth downward as in horror or fight. So it puts the angle of the mouth like this. When you are in fight or horror, you can show this expression. And it's supplied by the cervical branch of the facial nerve. So I told you the facial nerve has the 5 branches. The lowermost one is the cervical branch. So cervical branch of the facial nerve supplies this. It supplies the platysma. Is it clear to all of you? Hello? We asked in the,
Yes, sir.
we asked in the examination, remember, it may come as short note platysma. Now, coming to the orbitalis oculi, just hold on. If people are walking, I'll just close the door. Okay. Now, orbitalis oculi muscle. So this orbitalis ocular muscle, I told you, it goes around the eyeball, isn't it? So it has got the, not the orbitalis oculi, I'm coming to orbitalis oris. Okay. Oculi, I will discuss after this. Now coming to orbitalis oris, that goes around the oral cavity. So it has got the intrinsic part and the extrinsic part. So intrinsic part is for the deeper muscles. Okay. So the superior incisors originates from the maxilla, inferior from mandible, inserts the angle of the mouth. So these muscles you see here, that you find between the skin and the mucous membrane. Okay, you get the lip, upper lip and the lower lip, isn't it? So in the upper lip and the lower lip, you get the outer aspect, you are getting the skin. Inner aspect of the lip, you are getting the mucous membrane. So between these two, skin and the mucous membrane, you get the deeper part. Okay. So let's see. And you find, so you have the incisive teeth, incisor teeth, no? Just in front of the incisor teeth, these muscles arise and they go laterally towards the side of the mouth, and it will blend with some other muscles, with the astringent muscles. So intrinsic part, I told you, the upper lip and the lower lip. Outside you are getting the skin, inside you are getting the mucosal fold. So in between these two, you are getting the intrinsic part, and they arise from this incisive fossa. The incisive teeth you get in the upper jaw and in the lower jaw as well. So from there it will arise and it goes laterally towards the angle of the mouth and it will blend with the ascending part muscles. This ascending part muscle you see here, they come from the muscles outside the oral orifice. Yeah, I told you the buccinator, no? So that buccinator muscle you find it blend with the buccinator. This buccinator muscle, it will be in the middle only. Then you find the muscles you find at the upper aspect, the elevators, like the levator, levi, superior. Okay, levator, levi inferior called the depressors. Okay, levator, levi angularis at the angle of the mouth. So these muscles are ascending muscles. So two strata formed by the covering muscles. The thickest middle strata derived from the buccinator muscle. I come to buccinator muscle. So this buccinator muscle, I told you the trumpet muscle. So it will give some fibers, okay, and these fibers will blend with the ascending muscles, and you find the elevators at the angle of the mouth, just at the upper aspect, you get the elevators like the levator, levi superioris. Okay, down the angle of the mouth, we get the levator, levi inferioris. At the angle of the mouth, we get the levator, levi angularis. Okay, so they insert into lips and the angle of the mouth. So these are what the ascending muscles. Actually, what happens is buccinators and the superior and the inferior muscles, they come and they form a fibronodular node at the angle of the mouth called the melodius actually. And from the melodius, you find the crus. From there, you find the fibers coming medially. Some fibers goes towards the upper lip, some fibers go towards the lower lip. Okay, and some fibers go on the same side, and there will be crossing of fibers. Okay, so these are the intrinsic muscles that you find in the upper lip, lower lip, and these are the extending muscles that you find outside the orifice or the mouth. They come from the buccinator, and you find the elevators and depressors. Now, the action of these muscles, what does they do? You can close the lips, you can close it like this. You can protrude the lips as a whistle. You can whistle your, you can do a whistling, isn't it? You can protrude the lips, and you can do some grimaces as well. Various type of grimaces you can make out by the action of the orbital ocular muscle. So it is supplied by the buccal and the marginal mandibular. Okay, this is a very important muscle, remember. It comes in the examination as short note. Understood, all of you? Can you follow me? Hello?
Yes, sir. Yes, sir.
Okay. You see, I'll just make a diagram for you. I'm going slow because this is the last class, isn't it? Then, so you see here the lips, you get the lip, upper lip. Then you find the lower lip like this. Yeah. And I told you the upper lip will have this extrinsic muscle. The lower lip will also have the intrinsic muscle. Okay. These intrinsic muscles are what you find in the skin and the mucous and fold. So you get the incisor teeth. No? You get the incisor teeth in the upper jaw, and you find the incisor teeth in the lower jaw as well. Isn't it? And from this region of the incisor teeth only, these fibers arise and they go laterally to the angle of the mouth. And I told you the buccinator muscle is already there, the trumpet muscle. No? So it will give some fibers. Okay, and you find the muscles what are the elevators. They will elevate the angle of the lip. The depressors, they will depress the angle of the lip. Okay, and you see they are the angularis muscle. They will raise, they will pull the angle of the mouth as well. So all these muscles, they will come, they will meet the point what is called the melodius. Okay, you will form a fibro muscular node from the melodius like this. Okay, from this melodius you see here, it will form a crus. Means there is a division. Some fibers go up, some fibers go down, and some fibers from rope to down will come from below the rope will go like this. So there will be crossing of fibers like that. Okay, and they'll be going towards the lips. So the action of the orbital is oculi, the orifice is that You can close your lips, protrude your lips, and you can do various grimaces as well. And the nerve supply of this oblique origin is the uh, buccal branch, okay, and also from the marginal mandibular branch. So buccal branch and the marginal mandibular branch, they come from the facial nerve. Okay, that is what is the seventh cranial nerve. Is it clear to all of you? Hello.
Yes, sir.
Okay. Now, so pursing your lips, you can see, you can doing these movements, and closing your lips. You can you give a flying kiss like this. Now coming to this another important muscles called the orbicularis oculi, very important, remember, comes in examination. Orbicularis oculi that closes your uh, eyelids, upper eyelid and lower eyelid. So it will have three parts. One is called the orbital part, other is called the palpebral part, and the last is called the lacrimal part. Orbital part you see originates from the medial palpebral ligaments, okay, and the frontal process of the maxilla, and the nasal part of the frontal bone. So here you find the frontal bone, here you find the maxilla. Okay, so there are certain process in these bones from there. This muscle originates, as well as it originates from the medial palpebral ligament. So on the inner angle of the eyeball, inner angle of the eyeball and lateral angle of the eyeball. The inner angle of the eyeball, you get a ligament or the medial aspect, what is called the medial palpebral ligament. Okay, I'll just draw for you again. So, say, suppose this is what is the eyeball. On the eyeball, this is the eye. This is the middle angle. So you get a ligament called the medial palpebral ligament. On this side, you get the lateral palpebral ligament. Okay. So here you find the nose. So imagine the nose is here. This is what is the nose. This is the nose. Okay. So here you get the medial palpebral ligament and this is the lateral palpebral ligament. And this is what is the eye. So here you find the upper eyelid. Okay, this is the upper eyelid. And here you find the lower eyelid. Okay, lower eyelid. And this orbital part you see. So here you find the frontal bone. Okay, this is what is the frontal bone. This you find the frontal bone. This is the frontal bone. Very difficult to draw in the screen actually. You get the frontal bone over here. You get a frontal bone. So this medial part, this orbital part originates from this maxillary process. Okay, the frontal process of the maxilla. The maxilla will be down in this place. You get the maxilla over here. You get the maxilla bone over here. Then this is what is the frontal bone. So frontal process of the maxilla in this process. Okay. Then you find the nasal part of the frontal bone. So nasal bone is the nasal from this area. Remember this orbital part arises and inserts how this muscle it will go concentrically, it will go round the eyes and will come to the origin. You go round the eyes and you come to the origin. So this is what is the origin and insertion of the orbital system. So concentric rings runs to the point of origin. Now, what does it do? Protects the eye from the bright light, wind and rain, causes forceful closure in bright light. Okay. So when you are in bright light, as you come out in sunshine, in hot summer day or in bright sunlight, okay, this orbital oculi will contract to reduce the rays of sunlight. So that is the action of this orbital oculi, orbital part. Now, palpebral part you see arises from the middle palpebral ligament. I told you that this is the middle palpebral ligament, and it goes literally like this, the little palpebral ligament. So it travels along the upper eyelid and travels the lower eyelid as well. If you go like this, close eyelid gently as in blinking. So when you do blinking of the eyelid or sleeping, you use the palpebral part. This is called the palpebral part as you do the blinking. Now coming to the lacrimal part. So lacrimal part you see, you get a lacrimal gland and the lacrimal sac. I'll show you. This lacrimal gland and the lacrimal sac, what they do, they will produce the tears. The lacrimal gland is on the lateral aspect of the eyeball over here, okay, inside the orbital cavity. And from here, so it will produce the tears. Okay, then it will come along the front of the eye. Okay, between the fornix. Okay, between the eyelid and the sclera and the cornea, it will come. This tears will come towards the medial aspect of the eyeball over here, and here lies what is the sac, lacrimal sac. Okay, and this lacrimal sac, it will store the tears, and from here there is a canal, okay, called the lacrimal canal, and this lacrimal canal, it will open into the nose, okay, in the inferior meatus of the nose. So sometimes when you cry, you see there will be you'll have this watering from the nose when you cry. These are not the waters actually; these are the tears that comes from the nose, and these tears originate from this lacrimal gland. They run along the between the eyelids and all, and will come to the lacrimal sac, and from there it will come along the lacrimal canal and will come to the nose, the meatus of the nose. So that is the course of this lacrimal apparatus actually. Now, this lacrimal part of this orbicularis oculi, it arises from this lacrimal fascia. You find a fascia that covers the lacrimal sac, okay, and also the posterior lacrimal sac. So the crest, there is a bone called the lacrimal bone. It has got a crest, from there it arises, and forms seats of the lacrimal sac. So it forms a seat around the lacrimal sac, okay, like this. Now passes laterally partial face of the eyelids to the lateral part of the graphic, and from there what happens? It will go towards the lids and go laterally towards the lateral orbital ligament. So that is the course of this orbital part of the orbicularis oculi. It will go towards the lateral orbital ligament or lateral orbital rossi. Now, what does it do? You see here, it dilates the lacrimal sac for shucking lacrimal fluid into the sac. So there is opening of this sac by contraction of this muscle, and the tears will enter into lacrimal sac. That is the action of this lacrimal part of the orbicularis oculi. And what will happen? So on the medial aspect of the eyeball, when you see towards the mirror, you can see there are some holes called the puncta. Very small hole is there. The tear will enter into the puncta, and from this puncta, it will come to the nose. You can see your own puncta. So standing from the mirror, see your middle aspect of the eyeball. So there is a swelling near the middle aspect of the eyeball, and to observe closely, there is a small hole, what is called the puncta actually. And these tears will come along the puncta to the lacrimal canaliculi. Okay, then will come to lacrimal canal, then will come to the nose. Now, this is supplied by the temporal branch of the facial nerve. Temporal branch of the facial nerve. So very important, what I'm telling you right now, the orbicularis oculi. So this orbicularis oculi comes as short of, remember, it will be 8 marks question. You have to draw the diagram, you have to tell about the origin, the insertion, the action. Okay, what are different parts of this orbicularis oculi? What is the nerve supply of this orbicularis oculi? Is it clear to all of you? Hello, students, tell me.
Yes, sir.
Yes. Okay. So very important muscles have discussed. The orbicularis oris, orbicularis oculi. Okay, it comes in the examination, remember. Now, the facial artery, I told you there is huge anastomosis in the face region. So when there is a cut, very important to see, when there is a cut in the face, there is profuse bleeding, particularly the boys when they shave their beard. So there is a cut in the face and there is profuse bleeding because there is anastomosis from both the right and left side. Okay. So the artery that supplies is what is known as the facial artery. So this is the facial artery, you can see. So this facial artery is very tortuous in the face. Tortuous means what? So it will be going this side, that side, very tortuous, because all the time you are using the facial muscles, the muscles of facial expression. The artery has to be tortuous, otherwise what will happen? There will be strain on the artery, even it may tear also because of strain and all. So it is tortuous. So where does it present? It is present between the superficial, the deep group of the facial muscles. So you find in the superficial, the deep group of facial muscles. And the facial vein will run behind the facial artery. So this is the facial artery, you can see. So this facial artery is, it rises from the external carotid artery. It rises from the external carotid artery. Okay, at the level of the greater corner of the hyoid bone. You get the hyoid bone in the neck. There is a corner with the called the greater corner, lesser corner, and from the greater corner it rises, and it will go in the base of the neck like this, and it will hook around the border of the mandible. So this is the mandible, no? So it will hook around this and will come into the face like this. So it will go up and up, having a very tortuous course, and about 1.25 centimeter lateral to the angle of the mouth it will be there. Then again it goes up. Along this course, will give some branch, the inferior labial, the lips, the superior labial, the lips, the lateral nasal, the lips. Then above it will give the angular branch. Then it will anastomose with the dorsal nasal branch, that's the branch of the internal carotid artery. So this facial artery comes from the external carotid artery, and it anastomoses with the internal carotid artery, the branch of the dorsal nasal branch in this region. Okay, so see the arrow that I'm showing you, there will be anastomosis over here, and it shows there is the anastomosis of the internal and the external carotid artery in this region. Okay, so I told you the facial vein runs behind the facial artery. So again, I will repeat this. So it branches off from the external carotid artery in the carotid triangle. So there is a triangle called the carotid triangle. When you come to the neck region, when you dissect the neck region, you will find a triangle called the carotid triangle. It itself is a lecture class carotid triangle. We will discuss later. Just above the level of the tip of the greater corner of the hyoid bone. Have you seen the hyoid bone? No. Okay, you see the picture in your textbook. Then what happens, you see, it passes through the submandibular region. So you get the submandible here, you get the submandibular region where you get the submandibular glands. So enter face by winding around the base of the mandible and pressing the deep cervical fascia at the anterior-inferior angle of the masseter. So you get the anterior-inferior angle of the masseter. So I told you when you clench your teeth, you can make out the masseter muscle at the anterior border of the masseter. So you can feel the facial artery. So when you palpate the facial artery, you can see the pulsation of it. Okay, glance your teeth, like you can feel the pulsation. So because of that pulsation, it is also called the anesthetic artery, anesthetic artery. Because you see here, this artery is very much near to the heart. So during anesthesia and all, if the anesthetist cannot make out the peripheral pulse, that is the radial pulse or the dorsalis pulse, you will feel the facial pulse because it is very much near to the heart. So if the facial parts, if they can palpate, that means what the heart is beating, the circulation is going on. If they can't make out the facial pulse, okay, or the pulsation of the anesthetic artery, that means what the heart will stop beating. You can, without doing the ECG, you can make out the heart stop beating. It's a very important artery for the anesthetist. So it is also called the anesthetic artery. You can make your own, you can feel the facial pulse as well. So you can put your finger in this region, you can press it tight in this region, so you can feel the pulsation of the facial artery. So runs upward and forward to 1.25 centimeter lateral to the angle of the mouth, by the side of the nose, the medial angle of the eye. I told you. So it will come like this, the angle of the mouth, about 1.25 centimeter lateral to the angle of the mouth, goes towards the nose and goes towards the angle of the eye. Okay. And what does it do? Terminates by supplying the lacrimal sac and anastomosis with the dorsal nasal branch of the ophthalmic artery. So this ophthalmic artery is the branch of the internal carotid artery. So you find a good anastomosis between this internal carotid artery and the external carotid artery. Can you follow me, students? Hello? Yes or no?
Yes,
Yes,
sir.
students, tell me.
Yes, sir.
Okay, you see, very interesting. A simple artery, of course. So it comes as short note. Remember, facial artery comes as short note. So when these questions comes, you must not leave it. You must write. You should not miss it. Very easy. It rises from the external carotid artery. Okay, at the tip of the greater cone of the hyoid bone, goes towards the submandibular region below the submandibular gland, comes to the base of the mandible, hooks around the base of the mandible, goes up, enters the face, separates the deep cervical fascia, goes towards the angle of the mouth, about 1.25 centimeters, the angle of the mouth, goes upward. You can see it gives some branches of the inferior labial. Labial means what? The lips. the superior level, goes towards the nose. Okay, let us have the nose goes up towards the angle of the mouth. Okay, then in anastomos with the dorsal nasal branch of the ophthalmic artery, the branch of the internal carotid artery. That is the course of the facial artery. And just behind the facial artery is the facial vein. And I told you this facial artery is very short crossing course. It comes as short growth. Remember, very important to ask the examination. Even you have to do a dissection on this facial artery. Remember. Yes. Now coming to the venous drainage. So the veins will have its course just back to the artery. So you get the supratrochlear vein, supraorbital vein, because they are above the orbital, supratrochlear, supraorbital vein. Then you find these two will join together and it forms the facial vein. Can you see this is the facial vein? This is the facial vein. Then you see this facial vein, it will go posteriorly. It will join with a vein called anterior diffusion retromandibular vein like this. And they together form the common facial vein and vein in the internal vein. Very important, remember this course. Supratrochlear, supraorbital facial vein goes backward and it joins with the anterior branch of the retromandibular vein and they together form the common facial vein and the vein in the internal vein. Now you see how this is formed. This anterior division of retromandibular vein. I'll come. So you get a superficial temporal vein, the superficial temporal region, the drains the temporal region. Okay. Then you find they come and join together. Then you find one more vein coming, what is known as the maxillary vein. They come, this superficial temporal vein, the maxillary vein, they together join in the from the retromandibular vein. This is the retromandibular vein. Okay. So it divides again the anterior and the posterior division. Anterior division, I told you, join with the facial vein. Posterior division goes backward. Okay, and it joins with a vein called the posterior vein just behind the ears. Posterior vein, they come and join together, and it forms the external jugular vein and vein in the subclavian vein. Very important. This diagram is very important. Remember, the venous drainage of the face comes in the examination. Remember, it comes as short note or it comes as a situation, but mostly it comes as a short note or brief question. Short note, if it comes, it will be of 8 marks. Remember, try to remember the diagram. If you remember the diagram, it's easy only. Now, this facial vein. Okay, it will give a branch deep, what is called a deep facial vein. And deep facial vein, what does it do? It goes to pterygoid plexus of vein. Very important. You see, pterygoid plexus of vein. They are the pterygoid plates, pterygoid muscle. It's from pterygoid plexus of vein. And again, it goes deep inside the pedal cavity and it goes to the cavernous sinus. Very important. Why it is important, you know, we have some regions in the face called the danger area of the face. Danger area. The danger of the face is that if you lose some infection in danger of the face, the septic emboli will enter into the vein and it will go to the deep facial vein, it will go to the pterygoid venous plexus, to the cavernous sinus, and it causes meningitis and even it causes brain abscess, very difficult to control antibiotics, and the patient may die. That is very important. So I'll come to the danger area of the face, very dangerous. So with that danger area of the face, you find the upper lip, okay, and in the nasal cavity, the lower part of the nasal cavity by the side of the nose. So this region will be known as the danger area of the face. Any sort of pimples, any cut by some rusted blade or something, you should not use it. If there is some, if you are infecting those areas, the bacteria will enter into this facial vein. From the facial vein, you put the deep facial vein. From the deep facial vein, if you go to the pterygoid venous plexus, then you go to the cavernous. Very important, comes in examination. As the danger area of the face and what is the course of it, very important, comes in this question. Now I'll show you the danger area of the face. What is that? This is the danger area of the face. This yellow color triangle you can see here. So upper lip, if there is some sort of pimple or some abscess or boil, don't use your nails. Don't use any sort of rusted blade or something like that. You will be losing infection and it will cause septic emboli that will enter in the deep facial vein. You go to the pterygoid venous plexus, you go to the cavernous sinus, whereby it will cause the meningitis. The meningitis is what is the inflammation of the meninges, and there will be cerebral abscess in the brain. This will happen. Even in the nasal cavity also, you should not injure the nasal cavity or but the walls of the nails also should not endure. If there is infection, it may lead to severe infection inside the brain. Okay, so this danger area of the face is what? It is a triangular area bounded by the side of the nose, medial angle of the eye, and the upper lip. Try to remember this diagram: medial angle of the eye, okay, both the eyes, this nasal cavity, side of the nose, or the nasal to the side of the nose, as well as the upper eyelid. Okay, so this is the danger triangle of the face or danger of the face. Are you able to follow me? Hello, students. Tell me.
Yes, sir.
Okay, we are concluding. Only few slides are there. Please hold on, because I want to finish it today. I want to go slow so that you can understand. I can hear only one voice. Who is that? She's a
Kirti Sharma.
yes, pretty very good. What happened to the others? They're going to sleep.
Yes, sir.
Yes, Shrivita, good. And others, boys?
Yes,
Boys?
sir.
Yes, and
Sir.
more response, more response, more.
Yes, sir.
It seems I'm telling stories and you are going into slumber. Is it? Yes or no? I'm not story.
No, sir.
No, so I'm not saying story. These are facts. These are what important for examination point of view. Don't miss. Don't miss. Okay, if you miss, you will miss marks. Okay. Don't think that because of COVID you are not having examination. Examination will be there. It will have you will have physical examination only. You have to come to the college and write. It will be not just like CBSE what they have decided online examination on. But medical is like that. You have to come and you have to physically you have to write in the booklets, ensure booklets, and that will be corrected physically. You will have the oral, you will have the practical. Okay, if the examiners cannot come, they will conduct online, and the internal examination will be physically present. What they are doing this time. Okay, for instance, for your case we don't know, but it will be like this, and you will have physical exam as well as you will have the practicals. Okay, the viva, everything will be there, because we can't judge you by doing online tests. Okay, now clinical anatomy, concluding part only, right? Now you see, this is a very beautiful lady, of course. She's a very beautiful lady, of course, but she's suffering from a disease called the myasthenia gravis. There's antibody against some receptors in the muscles. Okay, muscles getting paralyzed. Okay, a condition called myasthenia gravis. So, which is autoimmune neuromuscular disease. It affects the muscles. I need to break, talk, see. So much more. This is currently, there's currently no cure actually. You need to take some medicine. Okay. But we have hope to share and spread the awareness. So myasthenia gravis is classic disease that there is visual paralysis of the muscles, okay, because it's a autoimmune neuromuscular disease. Many people suffer from it, okay. Even our great actor Amitabh Bachchan also have this disease called myasthenia gravis. He's in medication for the last 30 years. He's having even the cirrhosis of liver, hepatitis B, so many diseases here, but he's a great actor. Anyway, okay, because they are celebrity, we take put attention on those. Now, this facial muscles, you see, there is a condition called facial palsy. This facial palsy is because of the paralysis of the facial nerve, the seventh cranial nerve. It is a very important paralysis. By examining this facial nerve, we can come to know whether the person is having some lesion inside the brain or outside the brain. Okay, if it is happening outside the brain is what is that? I told you the facial nerve comes out of the stylomastoid foramen. So between the mastoid process and the styloid process, when you read the base of the skull, you will come to know there's a foramen called stylomastoid foramen through which the facial nerve comes out and it enters the parotid, as I told you. So it will divide into 5 branches: the temporal, the zygomatic, the buccal, the marginal, and even the cervical. So these nerves will supply the muscles of the face, the facial expression. This is the motor nerve. So when this nerve is paralyzed, what will happen? I told you there is loss of nasolabial fold. These are the nasolabial fold. So on one side you see there is no nasolabial fold. Okay, there will be division of the angle of the mouth on the normal side. On the normal side, there will be division of the angle of the mouth like this. There will be dribbling of saliva from the angle of the mouth. There will be food stuck into the vestibule of the mouth. both talking to the stick and the tips. Okay, and the eyes will be open. There will be loss of transverse traces on the side of the paralyzed side. These are the clinical features that you find in the facial muscle. Very important. Okay, it comes like that. In medicine, it comes. We ask in anatomy, in physiology, it asks. Okay, examination of facial nerve. What are the signs and symptoms of this facial nerve paralysis? That's how it's called the Bell's palsy. Now let us see how the facial nerve paralysis look like. This look like this. You see here. See, this person is having the Bell's palsy or the facial nerve paralysis. So what you can notice is that there is loss of this groove, the nasolabial groove. There is no groove on this side. Can you see this picture, all of you? Hello.
Yes, sir.
Okay. On the other side is having this nasolabial groove, no, and this side is not having. There is deviation of the angle of the mouth because you see these muscles are paralyzed and these muscles are getting stronger. It's contracting the angle of the mouth towards the dominant side. So deviation of the angle of the mouth. And you can see he can't blink the eyelids. So all the time the eye will be open and there will be redness in the sclera, in the conjunctiva. Conjunctivitis will be there because you see the dust will fall, the dust particles will fall, and there will be irritation and there will be vascular engorgement. So there will be redness in the eyes. Okay, and there will be loss of transverse creases on the forehead on the paralyzed side. So this side is completely paralyzed. This side is completely paralyzed. And when you open up, ask the person to open the mouth, although he cannot open, but still you can make out there the foot stucking inside the vestibule, inside the mouth, between the stick and the tips. Okay, so there will be foot stucking over here. And again, you'll see the saliva will be dribbling down or drooling down this angle of the mouth to become like this. This is the clinical scenario of this, a clinical picture of the Bell's paralysis or the seventh paralysis or the facial palsy. Remember, what is this paralysis called? What is the name of this paralysis? All of you tell me. Bell's palsy.
Bell's palsy.
Bell's palsy. Remember, Bell's palsy comes a short term, very important, very important. Okay. So if you ask the person to blow air from the organ, he can't be able to do it. Even if you can do it, you put your finger like this and press it, he cannot hold air inside this organ. The air will come out immediately because this muscle is getting weaker. You can see here the facial nerve coming at this, giving the branches to the facial muscles. Okay, and this lady is also having, this is the location of the facial nerve, and this is the scenario or the clinical picture of the facial nerve paralysis. Now, the facial nerve is coming out of this foramen called the stylomastoid foramen. What is the name of the foramen? Tell me, all of you together. All of you, come on. Stylomastoid foramen. Is it clear? Yes or no? Hello?
Yes, sir.
Stylomastoid foramen, it comes out. Now, if there is some sort of inflammation in this nerve, inflammation means what? If there is some viral attack in this nerve, there is swelling of the nerve. When there is swelling of the nerve, this nerve cannot carry the impulses, and it will there will be transient paralysis. It may happen to you also sometimes. How you know? How you know it happened? Like sometimes, like when you get up in the morning, you go to the mirror. You have the habit to go to mirror immediately after raising up. Getting up, you go to the mirror and see your face. When you see your face, sometimes it happens that you have this deviation of the angle of the mouth suddenly. Okay, it is happening like this. You talk, there is slurring of speech. There is saliva dribbling down the angle of the mouth. There will be loss of nasolabial curve. It may happen if you are unlucky, if some viral attack is happening, you may have this facial nerve paralysis. Of course, it will be temporary. It will last for about 6 weeks or so. It requires certain physiotherapy exercise of this muscle to activate this facial nerve, then it will come into play. Otherwise, you have to, it will stay for a long time. You have to take some anti-inflammatory drugs like steroids. You have to take, you have to go for physiotherapy, you have to do all this conditions and all. And in that way, it can be healed. If it is because of some idiomatous condition, it may happen to be also you also sometimes. Suddenly you will have this Bell's palsy. It will be transient only. But if it is because of some damage to the facial nerve, it will be a permanent one. Okay. Now, this is what is happening outside the cranial cavity, so this is called the lower motor neuron paralysis. If it is happening inside the brain, inside the cranial cavity, it will be known as the upper motor neuron paralysis. In the upper motor neuron paralysis, it will be quite different. Okay, the signal will be different. So what will happen? These transverse fissures will find on both sides. Only there will be paralysis on the lower part of the face only. There will be loss of nasolabial fold. All the fissures will be same only, except the transverse fissures should be present in the forehead on both sides. But if it is, but this one, the lower part of the face down to the this eyebrows, okay, it will be common for both upper motor neuron and the lower motor neuron. But one thing is there, like there will be crossing of the fibers that will learn in central nervous system. So if there is some sort of tumor or stroke or injury to the head, if there is on the left side, there will be paralysis on the right side. Okay, if there is paralysis on the stroke on the left side, there will be paralysis on the right side. It happens like this because they're crossing the fibers. But this upper part of the forehead is supplied by both sides from the cerebral cortex. So this upper part of this forehead escapes this paralysis. Okay, so it happens. So you can make out the upper motor neuron paralysis and the lower motor neuron paralysis. This is a very important part in medicine, in neurology, that we learn in final videos. Upper motor neuron paralysis, lower motor neuron paralysis. But the basic things you should know how it happens in the facial nerve. Okay, the so in the book it is also explained nicely. You try to read it out. If you have any doubt, you can ask me. Okay, that you can make out. So apart from this Bell's paralysis, you have the myasthenia gravis. I told you the motor neuron neuromuscular disease, autoimmune type neuromuscular disease, and microsomia. In some people, you see the face is asymmetry. One side is small and other side is small. So you find microsomia. Okay, or the face can be very small sometimes. Myotonia, the facial muscles can be weak in some people. There will be ptosis. Ptosis is what you see when there is paralysis to the upper eyelid. The nerve that supplies the upper eyelid is actually the third cranial nerve, that is what is the oculomotor nerve. So when it is paralyzed, this eyelid cannot cover the eyeball. So it will half cover. The condition what is known as the ptosis. What is that condition called? Ptosis. Remember. So ptosis and all, it comes in some fill in the blanks or MCQs. Remember ptosis. So there is paralysis of the upper eyelid. When there is paralysis of the upper eyelid, what will happen? It will cover the eyeball halfway. And this facial muscles are interest for the dentist because they need to do the dental extraction or they need to repair fracture of the mandible and all. The facial-maxillary surgeons, they should know about this facial muscles. They should know. It's not like that. They know very well about this facial muscles. And I told you already the cavernous sinus thrombosis. So this cavernous sinus thrombosis is what you see in the danger area of the face, like the upper eyelid, the outer aspect of the nostril cavity, the inner aspect of the eyes. You see, there's a triangular region. They inject some bacteria. Okay, what will happen? It will form a septic embolus. It will enter into the facial vein. You know the facial vein, the drain blood, isn't it? And from the facial vein, it will go to the deep facial vein. From the deep facial vein, it will go to the cavernous sinus, so the pterygoid venous plexus. This cavernous sinus is a cavity that you find at the base of the brain, where you find pockets of blood between the dural fold. And if the bacteria lodges there, it will cause cavernous sinus thrombosis. Okay, and it may cause meningitis, it may cause cerebral abscess, and that's very dangerous. And many times it is fatal. We cannot control it by giving simple antibiotics. It's very dangerous. So don't take the pimples that you find in the danger of the face. Don't use the pimples don't squeeze the pimples with your nails, because you see the nails have all this bacteria and all. Now it is facial muscles. Okay, it feels very nicely because it has got good anastomosis, very good anastomosis within the blood vessels, particularly the facial artery, and it is very good for cosmetic surgery. Okay, this cosmetic surgeons, plastic surgeons, they can make up the face, they can do operation on the face, and the healing is very good because of the good anastomosis within the blood vessels. So this is for the Bell's palsy, you know already, okay? And these are the, you see the forehead creases. What the operations plastic surgeons do, the eyebrow lift, the frowning line, the toes, funny nose, all this they can do, this sort of operations they can do. See, there is a condition called the crow's feet. Crow's feet is what? When there is paralysis to this upper ocular muscle, okay? When this ocular muscle it contracts, there will be creases on the temporal aspect, on the lateral aspect, on the inferior aspect of the eyeball. So it looks like some crow's feet. Okay, it looks like some crow's feet. There are creases over here. And these creases are permanent in case of some old people. You can see there will be creases on the side of the eyes. Okay, so particularly in old age, because of the loss of the substance that you see some creases around the eyeball. Okay. So, and lastly, you can make out the muscles of the face, I hope. Okay, let's see. I'll just point out, you tell me the name. What is this muscle number one? Anybody? Can you tell me what is the name of this muscle?
Frontalis.
Frontalis. What is the name of this muscle that is silent?
Temporal.
Temporal, it's good. What is the name of this muscle?
Orbitalis. Ossi.
Orbitalis oculi. So it goes round and round the eyelid. You can see three parts I told you: orbital part, lacrimal part, and the palpebral part. Isn't it? What is this muscle? You can see number 4. This is a mastication, of course. What is that called?
Masseter.
Masseter. Good. So this muscle it helps in mastication. Isn't it? What is the name of this muscle? Number 5. You can see.
Buccinator.
Yes.
Buccinator.
Trumpet muscle. Isn't it?
Buccinator.
Yes. What's the name of this muscle round the lips? You can see number 6.
Orbicularis.
Oris.
Yes, orbitalis. Very good. So you have done the name of the muscle. Very important. So if you can remember the names of the muscles, but of course you should know in details about the orbitalis oculi, orbitalis oris, buccinator. These are the important muscles. The facial nerve is important. The Bell's part is very important. How you examine the Bell's means the 7th cranial nerve. Okay, and the branches of the facial nerve very important. I told you the 5 branches. Remember. Okay, so I told you the orbitalis oris, orbitalis oculi. Then you see the buccinator, the masseter, the temporalis, zygomaticus major, zygomaticus minor. This zygomaticus muscle of mastication will have a separate class, of course. Yes, I'm highlighting the name. Okay. So the clinical features of the Bell's palsy is very, 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 very important. Remember, you see your book today itself. And you should know the facial artery comes as sort of, remember, it marks the course of facial artery, how it enters the face, from where it comes, why it is tortuous, what anastomosis to, what are the branches of it, as well as the picture of this venous drainage. Try to remember venous drainage. So lastly, the lymphatic drainage of the face, just few lines only. So it goes to the retromandibular lymph nodes, okay, retroauricular lymph nodes, and to the submental group of lymph nodes. So from this region of the face, it will go to different groups of lymph nodes. So this finishes the muscles of the face, okay, and the other things of the face. I hope you have understood, all of you. Yes.
Yes, sir. Yes, sir.
Yes. Try to make a note of the muscles that I told you. Not all the muscles are necessary. Only orbitalis oculi, oris, masseter, buccinator. Okay. The facial artery, venous drainage, and the facial nerve. That's it. Okay. Thank you so much.
Thank you, sir.
Thank you, sir.
So please read it, right? Thank you. Bye. Have a good day.
Thank you, sir.
Thank you.